Hi everyone, my name is Petros. I'm one of the MSK physios at the practice, and today I'm going to talk about the patient experience and talk about this initial consultation and what you should expect of the 60-minute appointment. So first things first, as we walk through the doors, you'll be greeted with a warm smile from our lovely receptionists. Then have it in the reception room and wait for your physio. Then the physio is going to call your name, get you in the treatment room. So we have many different treatment rooms in the practice, some upstairs, some downstairs, and we have a gym, a separate gym that we like to use with most people, or pretty much everyone, to get them in, try the exercise programs out and see if the person can do the exercise at home. So we're going to talk about the initial consultation, why we actually need 60 minutes instead of 30 minutes or less. So 60 minutes is quite a good time for the physio to take your history, start forming that relationship that is needed to meet the person, get to meet them as well, get to meet the physio, and get as much as you can from the session. Firstly, the physio will start by asking some general history questions. They'll make you talk about your injury, your past injuries in the area, if any, and try and connect those dots that lead up to the ending product of the injury that is today. And that is going to help the physio get a better understanding of where you stand at the moment, maybe your fitness level as well, what you can and can't do at the moment. And that's going to help us to determine what kind of plan we need to set for the future, along with your goals, to get them both mixed and get the optimal product for your rehab. So the initial consultation is sort of divided into three parts. It's first the history taken, a bit of the chat about the history, then we like to do an assessment to give us a better understanding when we actually go on the problem area, when we have a feel for it, when we have a look at the quality of the movement, and that's going to definitely give us a better understanding as well of where things stand with the injury and what we can do in terms of mobility, range of movement, and what we need to improve on to get you back to where you were before. So after the assessment, we can have a good hypothesis in our head that we're going to be able to explain to you and talk about the different healing times, and that's going to lead us on to the final stage of the consultation, which is the treatment. So we like to fit in a sort of treatment in every one of our sessions so that we see how the patients respond to the treatment, if they get an improvement. Not all the patients get improvements after every treatment. Sometimes it feels a little bit worse on the day, but then it eases off. But that's why we need to do the treatment. It's a bit of a trial and error sometimes, that we need to first try a few of the treatments and see if that works. If that doesn't work, then we can change up the approach and try something different to make sure we have the optimal treatment to get you back to where you were in the shortest amount of time possible. Right, so to summarize, to put it into simple terms, the initial consultation basically consists of the history taken, the assessment, and the treatment. So what we like to do different usually, we're more of a hands-on kind of practice. We like to take our history with all the patients so that we can connect the dots and get our hypothesis in our heads. We share the same ethos as physios in the practice, that we like to keep a holistic approach while being hands-on. So we view the body as working within a system rather than in different specific parts. And even though we do share the same ethos with the different physios here, everyone works a little bit differently with their handling, with their techniques. So and everyone asks different questions about the past, but ultimately it's to get you the best experience possible and to get as much as you can from the sessions. So what you can gain from the initial session, so you do gain some advice from the physio. We'll try and advise the best we can on what we can and can't do. The best thing to do is come with a few questions of your own, and if you have those questions you can ask us and we can try and answer them to the best that we can. And also we'll get a better understanding of your injury, get a better understanding on how the body responds to your injury, about the healing times, and what we need to work on to get you to the place you want to be in maybe a few months, in a few weeks, depending on the injury. Going forward, after the initial consultation, the physio will go through the goals with you and give you a personalized exercise program to do at home. And some of the work will be done in the treatment rooms, in the follow-ups, and some of the work will be done by you as a patient at home. And that's going to lead us on to the follow-up sessions, which are 30 minutes long, and that's going to focus more onto that treatment and the hands-on that we need to do to try and see if we've got the optimal treatment for you, or if we need to change our approach to make things get better faster. So thank you for watching, hope you enjoyed the video, and if you have any other recommendations, any other questions you want to ask us, drop them in the comments and we'll be in touch. Thank you.